Beginning this week, teachers will become the next group in North Carolina eligible for the COVID vaccine. They join healthcare workers and anyone over the age of 65. In today's 2-Year Well-Being, we're breaking down everything you need to know about vaccines. Cone Health's Director of Pharmacy and Oncology, Dr. Andre Harvin, is joining us. So first and foremost, right now we know that Pfizer and Moderna vaccines are available. Is there any kind of update on the other vaccines, such as the Johnson & Johnson vaccine that maybe would become available soon for folks here?
Yeah, very exciting news. And one, thank you for having me. But very exciting news coming out about the Johnson & Johnson. So they have submitted their application to the FDA to get that emergency provision that both Pfizer and Moderna received. So we expect the FDA to completely review their information starting on Thursday of this week. So we could see a decision from the FDA come out anytime this week or early next week about whether or not they'll approve it for that emergency authorization. So great news on the horizon for that.
All right, and so the main question that we get when we talk about the vaccines is, why is the Johnson & Johnson vaccine only one shot versus Moderna and Pfizer, which are two?
Yeah, the big thing that separates it is actually how they studied both drugs. So Johnson & Johnson specifically approached the vaccine with trying to find one that they could do one dose with. We know that 2 doses is very complicated. You have to bring people back. Sometimes it's going to be hard for people. So the way that they actually designed the study with their intent to come out is that you'll notice that the other 2 vaccines have like 95% efficacy, which is exceptionally high. The Johnson & Johnson vaccine is significantly lower, about like 65 to 67% what we saw in their initial data, which is still great. I mean, that's great protection. I would take any vaccine that is available to me, but they designed their study specifically to look at a 1-dose option of whether or not the body could produce enough antibodies that it would still be effective against COVID-19. So it's really the study design, what their intent was. And again, all 3 vaccines really, once they are available, are great for the community.
So can we do a breakdown of the numbers of the efficacy of the Johnson & Johnson versus the Moderna and the Pfizer?
Sure. So the Johnson & Johnson, one of the big things they look at is symptomatic of COVID-19. So they're looking at mild to moderate disease. So that's something that, shortness of breath, having to use supplemental oxygen. We see that in a lot of patients that get really sick, or any level of hospitalization. So the Johnson & Johnson specifically looked at, we want to look and make sure we're reducing that kind of more dangerous COVID-19 infection. We know a lot of people have asymptomatic, they get it, they really never know they have it except for some very mild symptoms, but really looking at those patients that may need to come in the hospital. Their vaccine was really focusing on those patients of, can we prevent them from coming into the hospital and potentially having really bad outcomes once they go in, like long-term hospitalization or even death. And so again, their efficacy is not as high when you compare that to the Pfizer and Moderna, which are 95% effective, essentially between both of them. But that 65+% effectiveness is exceptionally good. So that's on par what we see with our normal flu vaccine that we get every year. It's still a very high efficacy rate and still something that's very good in terms of protection against COVID-19. But again, theirs is only 1 dose, and we know that that is advantageous. It also has better storage, so it's easier for us to get to members of the community. And again, it's hitting the big thing, which is hospitalizations, really bad levels of COVID. So again, a very, very effective alternative to the Pfizer and Moderna vaccines that are available now.
Just a thought, do they have less side effects then?
Not from what we're seeing through the preliminary data. We know that side effects are pretty common with this type of vaccine. So there's been a huge study that was produced from the CDC. I think it was early last week that just showed that, yes, most people that get the vaccine are going to have some type of side effects, but a lot of them are very, very mild. I had a pretty bad headache, admittedly, on my first one. We're seeing those same kind of side effects with the Johnson & Johnson. So it doesn't mean that all of a sudden there's less side effects. It just means that it's 1 shot, a little bit less efficacious, but again, very, very effective in what we're looking for and what we're trying to prevent.
So for the people who are still just a little hesitant about getting the vaccine, what thoughts or messages do you have for them?
Yeah, it's a great thing. I have this conversation a lot with both of my parents. They're not really in the age group right now where they're eligible for it, but hopefully they will be soon. So the big thing is, when you look at the numbers, we are vaccinating over 1.5 million people in this country per day, which is amazing. And of those 1.5 million people that we're vaccinating day in, day out, we're not seeing any debilitating side effects. Again, the adverse events that we're seeing are in line with what the package insert says. Yes, sometimes there are those, what they would consider a life-threatening or anaphylactic reaction, but we're seeing it 3.5 to 4 times of every 1 million doses of the vaccine given, which is great. When you compare that then to the rate of COVID-19 infection, the death rate, hospitalizations, that's much higher. At one point in time, we had people dying of COVID every 2 to 3 minutes here in the United States. So when you really compare that just from a numbers perspective, from a data perspective, it's really it's a slam dunk, right? You want to make sure you go ahead and get protected from this. It helps us get our lives back. And so those that are on the fence, I really just encourage them to maybe, not look on Facebook, just go to the CDC website. You can even look at either Pfizer, Moderna, or Johnson & Johnson's websites where they have all of this information published, and really just look at the overview. It'll tell you that these are extremely effective, will protect you and your community. And again, the side effects, though some of them don't feel so great, again, it's very transient. You're going to have it for a day and then you're right back to your normal self.
All right, well, let's talk about different communities, because specifically for people of color who are hesitant about getting the vaccine, with all of the history, with the Tuskegee Project and all of that, what do you tell them?
Yeah, I think the best thing that I can do is just serve myself as an example and try to have conversations just like this. So I was one of the first people in line to get the vaccine. I wanted to show that, hey, I believed in the science, I believed in the data, I felt as though it was safe. I'm not ignorant to what has occurred with African Americans and our brown members of our community when it comes to healthcare, when it comes to things like the Tuskegee experiment. We know that there are gaps. We know that there are systemic issues that still plague all of these communities. That can still be true. And at the same time, we need to be able to trust in those professionals that have really put their entire careers on the line to bring this kind of vaccine to the market, that have put their name and their reputation behind its effectiveness. And just, again, look at the data. So it's important for us all to try to close those gaps. And this is one of the biggest steps that we can take. We know that COVID disproportionately impacts Black and brown communities, not just here in North Carolina, but across the entire country. And so this is that opportunity for us to start to close that gap and start to get our lives back on track.
Okay, and we all want to know, do we still need to wear a mask after we get the vaccine? And if so, why is that?
Yeah, that's a big question. So if I was in my office at work right now doing this, you'd probably see me with a mask hanging around my ear. So even after you get the vaccine, and I've had both doses, fully vaccinated, you still want to go ahead and wear that mask, socially distanced, and practice good hand hygiene. All those are still very effective, and they're still really important. So the reason is that even though these vaccines are extremely effective, 95% effective, that's not 100%. So there is still that risk that exists in the community that you could be fully vaccinated and still contract COVID, and it could be that more extreme version of it where it overwhelms your immune system. On the other hand, you may end up getting COVID that's asymptomatic. So you still want to make sure you're wearing your mask, social distancing, and practicing good hand hygiene, because you don't want to be a spreader of that COVID-19 vaccine either. So for now, we have to be really comfortable with our mask, our social distancing, and our hand hygiene. It might be one of those things that we just continue for a good amount of time until that vaccine is out in the community and we've vaccinated enough members across the entire country to be able to really have that conversation about not wearing masks anymore.
All right. Speaking of trying to vaccinate all the people in the community, there's been the delay in the vaccine distribution, the appointments, they fill up so fast. A lot of people are worried about not getting a vaccine. Should they be concerned?
They should not be concerned. So this is a big event. So this is a mass inoculation that is global. And so this is probably one of the most unprecedented things that we're attempting to do. And a lot of times it's going to be easy to feel like, hey, I'm just going to get lost in the shuffle. When's my turn to get a vaccine? We know that we have commitment not only from providers in the community like home health. We know we had it at the state level, we have it at the federal level, that everyone that is willing to get a vaccine, and we hope that everyone is, will get a vaccine in time. It's going to take us a little bit of time to roll this out. We had hiccups early in the process as we learned more about it. We were making sure that we were communicating at both the state and federal level to make sure that we got the appropriate allocation. We believe that we've worked through the majority of those potential interruptions and feel very confident on our continued vaccine rollout. So the best thing to do is just keep your eye on the websites, either through Cone Health or through the North Carolina Department of Health and Human Services, to make sure you know when you're eligible to get the vaccine and areas that you can get the vaccine. But if you are willing to get the vaccine, and again, we hope everybody is, we want to guarantee you that you will be able to get that vaccine.
All right, Dr. Harvin is going to be with us until 6 o'clock answering your coronavirus questions. You can text your question to the number 336-379-5775. We're going to take a short break and we'll be right back.